I hear there's no backtracking from your message that you're not going to backtrack from the insistence that healthcare workers get vaccinated by the 1st of October. And secondarily, there's an article in the Providence Journal today that suggests that as many as 1,000 or more URI students have opted out of getting vaccinated based on a religious exemption for which there is no standard. There's no statement of why they feel that they shouldn't be vaccinated. What do you say to that?
Well, I say first, congratulations to URI to get over 94% of the student body here vaccinated, and hopefully they get as much success with their staff. If we could do that on a statewide basis, we'd be doing a victory lap. So thank you for that, Mr. President. As far as the healthcare workers, we put that in because we believe healthcare workers keep people healthy, and we need to have them as healthy as possible to do that. I would add in, though, we're not hard fast in terms of discussions in terms of how we can help make that work for these organizations. I spoke to the leader of the fire union today. We'll be meeting with him tomorrow, and he acknowledged that it's an issue that he wants to talk through with us. But he also acknowledged this one important stat. His members, his union members, firefighters in the state of Rhode Island, by the way, thank you to all our first responders for getting shots in the arms. We activated them, and he acknowledged the fact that I helped activate our first responders on 39 communities. They've grown, I think, up to 90% of the firefighters in the state of Rhode Island are vaccinated. So when we start talking about the people who are unvaccinated, we'll talk to them, and we'll see how we can help them get to the point where they do get vaccinated, and then where they can't, we'll continue to talk to them about the roles that they can play and to keep us safe in the state of Rhode Island. And
to follow up, if I may, and the students who are claiming an exemption from the vaccination?
Yeah, so and again, I thank the universities. The President may want to speak to that, but I thank the universities in the state of Rhode Island, as the Commissioner said, the first state in the country to have all our universities put a vaccination protocol in for their student body. So, but it is each university that is working on their protocols. So they need to work through that in terms of what makes sense to them. But over 94% of a student body vaccinated at a university of Rhode Island, you know, I think that that'd be the envy of any university in the country, to tell you the truth, and we're very proud of what has happened here.
Mr. President,
yep.
If you would.
Yeah, thank you for that question. So it's very important to begin by saying that the University of Rhode Island is a very open and welcoming university community. It is a very diverse student and faculty community, and of course we have people from around the world that also choose to come and study here. And so we believe that, and it is my strong belief that it would be inconsistent with our values of inclusion at the University of Rhode Island to question the authenticity of anyone's religious beliefs or philosophies. So we have a very strong testing procedure in place that we know the incubation period is 3 to 5 days, and it is for that reason that on Monday and Tuesday, folks will be tested on campus, and then again on Thursday or Friday they will be tested.
I'm guessing you're vaccinated?
I am. Yep.
Thank you, Pat.
Governor McKee, last Thursday, the Supreme Court, moved long predicted by the legal community, issued a judgment voiding the CDC moratorium on evictions. Friday morning, Rhode Island District Court revised the court's eviction protocol. But clearly this is an overnight crisis that is over a year in the making. And while the offer to station Rhode Island housing personnel in housing court is generous, they'll have absolutely no legal authority to intervene in the proceedings in anything other than an advisory capacity. And it will certainly not provide relief to landlords or tenants. My question, threefold. How many man-hours currently are being dedicated to processing applications? What is the current projected time period between application and receipt of funds? And finally, is it time for Carol Ventura, the head of Rhode Island Housing, to step aside?
So I'll get you to the answers to those questions. Let's keep it to the COVID and here, and I'll be happy.
This is happening. People are about to be evicted.
So I don't have those numbers readily available, but we are working through those issues. As I mentioned on Tuesday, talked to the White House. in terms of making sure that they understand that their restrictions on the application process is really slowing us down. And so we're doing everything that is possible, and we're going to hold anyone that needs to be accountable. And we're working our way through those issues, not only utilities, but rent and others. I met with people who are advocating for homeless today. There's no reason, again, for anyone during the COVID who is that is in an apartment to be evicted out of an apartment. There's money there. We'll make sure that they get the money. They should be making sure they contact our office if they're having difficulty on their utilities or rent.
Quick follow-up, is it appropriate to provide a religious exemption to university employees and/or students, but not afford the same religious exemption to medical care workers who are being routinely denied that via computer-generated response?
Yeah, so that's a decision that'll be made by the state on relative to state policy, and then this will be a policy that the president has already spoken to, and I think he did a good job speaking to that issue.
Thank you. This is a question for you, Mark. I'm looking at this policy here that you're going to require vaccinations of staff by October 15th. And this is apparently an agreement with unions. If they are not vaccinated, what will happen?
So, so we believe, first of all, I think this has been a policy that's come together in close consultation with the faculty. And so we know that there is strong support among the entire university community for this. In the instance where for medical reason or for religious reason that somebody is not, then what will happen is, as mentioned earlier, then there will be the testing procedure. And so folks will be regularly tested on campus twice a week.
Will people be dismissed if they cannot provide proof
Of
vaccination if they don't have a religious or medical exemption?
So we are going. So in that case, there will be options for first of all for quarantining and off campus, but we will not be in a situation where we have people on campus who are refusing to get vaccinated and refusing to get tested.
Thank you.
Yeah.
Bill?
Two questions for Dr. Alexander Scott. First of all, ought there be a rubric for medical conditions or even for religious specific decisions or processes, or however someone comes to the notion of a religious exemption? Ought that be spelled out at this point very specifically so that it's not just used in the case of someone trying to circumvent a vaccine mandate in a particular sector? Is that something that the Department of Health will print and put out?
Yeah, it's a process that we're very familiar with. We've used it with many of our vaccines in terms of exemptions. For medical exemptions, there are very specific diseases that qualify. It's naturally rare, so it's even less common to have someone have a medical requirement that's beyond that, but we have offered support to any providers that want to reach out to RIDO for assistance with that. In terms of a religious exemption, it's obviously a little bit more complicated, and the approach, it's why we really tout what Rhode Island has done well for years in terms of immunizing our populations, our children and our adults. And for healthcare workers, everyone wants to ensure that if your loved one or your family member has to come in encounter with the healthcare system, that you're confident you're doing that with a healthcare staff person who is vaccinated and protected. So that's really why we focused on just limiting it to the medical exemption and getting as close to 100% as possible for our healthcare workers, knowing the vulnerable population that they're caring for.
But are you concerned about that being exploited? Like, is there a list of here are the 10 conditions that qualify you for a medical exemption, and if you're not one of those 10, then you don't qualify? Are you concerned about that?
No, that list exists. We use it for all of the immunizations that we have medical exemptions. It's based on information provided from the CDC. We have a standard medical exemption form. And so going beyond that would require an actual clinical provider to determine qualifications. So there's less concern, and we know that most Rhode Islanders get it. It is important to get vaccinated. That's going to make a difference, along with the other mitigation steps of the indoor masking and the testing. That's what's going to get us through the rest of this and keep our loved ones safe, alive, out of the hospital. Those continue to be our goals.
And lastly, there's chatter this week that antibody being infected in the past with COVID-19 has the same or greater opportunity for one to be immune to COVID than the vaccine itself. It's being pushed by some elected officials, one particular medical doctor. Is this nonsense? Is this real? How do you feel about that statement in general?
The CDC and other public health experts have made it clear that natural immunity may help a little, but it by far is not enough, particularly with this current Delta strain. What you can be most confident in terms of immunity is being vaccinated for staying alive and staying out of the hospital. We are urging everyone, regardless of if you have had coronavirus in the past, to get vaccinated so you have that added level of assurance that you can be protected against an extremely transmissible strain of coronavirus.
Thank you. We have time for 2 more questions.
Director, what are you hearing from the hospitals about? Are they preparing to lose staff over the vaccination issue? Are they going to terminate people from what you've heard who do not comply?
We've had a strong working relationship with the hospitals. We've actually applauded the hospitals for the work that they've done, and they've encouraged us. This is the route to go. We want to be able to ensure that any patient, any family member can know when they step foot in our doors, they're going to be encountered by a healthcare worker who is protected and vaccinated. And so they have done everything to engage the healthcare working staff to ensure that the majority of their population is vaccinated, and they've done everything to account for if there are, unfortunately, healthcare workers who don't have that same belief of ensuring that any patient they come before, they are doing everything they can to keep them safe. They want to bring in the folks who do have that belief and who do support the importance of making sure that all patients, especially the most vulnerable, are safe. So hospitals have been leading the way on this. They have been behind this approach, and we're standing firm on that October 1st time and working with everyone to help ensure the impact is appropriate.
So what do you expect to happen on October 1st, though? Will those people who do not get vaccinated lose their jobs?
We're hoping that no one does. We have really been pushing on the engagement and the education, but we're also making clear this is where we have to draw the lines. And we've appreciated the hospitals that are saying we're doing everything we can to make sure everyone has access to getting vaccinated. And if at the end of the day there's someone that doesn't have that belief of making sure every patient comes across a healthcare worker who is vaccinated and will help keep them safe, they want to, reassess that and see how to make sure we can all follow this requirement.
Governor, are you expecting other colleges and universities to follow URI in requiring the vaccine among faculty and staff? And are you pressuring any other institution, whether it be academic or otherwise, to do that?
Well, I think it's been pretty clear that I believe that local decisions are important, just like I did on the school masking. We got 95% of the school districts to agree to do a masking policy in their communities. I'll leave that up to the universities. I think just the evidence here today shows that it's a huge success for us here in Rhode Island, what's happened on the University of Rhode Island campus relative to keeping students safe, faculty safe, and welcome them back to keep our economy rolling and keep our kids educated, right? We want our kids that are in the University of Rhode Island, whether from Rhode Island or from outside the state, to be stay in the state of Rhode Island, and they got to be here first to get the education to actually have that happen. So I'll leave the local decision to the universities, and we'll support their decision because I believe that, they're making very good decisions right now for us.
We'll take our last
Okay, hi. This question is for anyone or for the governor. There was a report that there are hundreds of students throughout the colleges of the state that they're under that medical or religious exemption, so they're not vaccinated. Will that even help leveling off the spread of COVID on campuses, considering that hundreds of students won't get that vaccination? Or?
Yeah, that's the question from Dr. Alexander Stout. I would just say, if we get to 94% of everybody that can get vaccinated in the state of Rhode Island, if we could get to 94% in every high school and every middle school in the state of Rhode Island, we're going to be very pleased with that.
So if I understand your question properly, thankfully, the majority of people are vaccinated, which is critical. For those who are not, it's up to the school in terms of how they are handling it and ensuring, as the president shared, that everyone that's on campus that is interacting is protected as best as possible. So we really hold up the colleges and universities that are beyond the 90% mark and pushing towards 100, because that's the model that we want to strive for with employers, businesses, organizations, institutions statewide. That's what we want to push towards with vaccination, indoor masking, testing, and any other mitigation step that we know will get us through this third wave of the Delta strain. Thank you, everyone.